Chale wamushima naye baukenda ndesiko anga tamashenya yafara kwa balika siwulu babasizana sibakasomulo kubuka tupene ka feratona instead ya kula tuse atao mulao yanaweza chwani wakala kunto kubonisa manenge kuli chale kamusizana kale ngeto yale akinisiko akona kuyeza kuziseza abantu babwe na pi
sebulile seboni venya ona fale mushemi asashwa fera bashemani baba kutura kuti ariko pazulalizazi nina musalira musasinganye kaza bokisi mankomoni kwale kala ashera kale bayopa
uniting end violence against women and girls. So today we now want to talk to girls. We discuss, we teach each other, we ask questions where we're not clear on how we're going to unite to end GBV, to end violence against girls.
International Day for the Elimination of Violence Against Women is a period of 16 days of activism against gender-based violence, which is observed from the 25th of November to the 10th of December every year since 1981 to increase the public awareness of the adverse impact of violence against women on one's health and society, and to reaffirm the commitment of working together inclusively. On this day, World Renew and the United Church of Zambia, Cfgb, civil society organizations, governments, and the United Nations and other partners came together to organize meetings and education programs honoring the 16 days of gender-based violence activism in Zambia and Mwandi district in Sete.
My name is Olivia Nachilongo Masala. I'm a gender officer working under World Renew under the Canadian Food Grains Bank project, which is being implemented by the United Church of Zambia in Mwandi, the project that started in 2022. So this project has got 4 thematic areas that we are looking at: the nutrition, livelihood, agriculture, as well as gender. This year we are commemorating the 16 days of gender activism against gender-based violence here in Mwandi. The commemoration is looking at the theme, which is to unite, so that we unite to end violence against women and girls. And we've got a lot of activities that we are doing as World Renew in Mwandi. We started on Monday on the 25th and we'll go up to the 10th of December to make the 16 days of activism. So as of yesterday, the staff and other community agents that are working with us were in Sankolonga, where we had some Bible studies and community dialogue sessions that we are speaking against gender-based violence. These were being facilitated by the community agents for gender that we have in Sankolonga community. As of today, looking at the activities that we have lined up, we are also doing some mentorship for girls on how to prevent and report these GBV cases. As girls, they also have to know what violence is or what they may be facing, and some may be ignorant, and we decided to do a mentorship for them so as to just open up their eyes so that they know how to prevent them and report the cases of GBV. Many other activities that are lined up and which will be ongoing till the 10th of December. We shall engage boys as well. We are not leaving them out so that they can also be agents of change. Later on, we have different other activities where we have school debates, story writing, and just the involvement of other community members, where we are going to unite them as well so that we can commemorate together to put an end to the violence that is ongoing against women and girls.
Gender-based violence manifests in various forms, including physical, sexual, emotions, and psychological abuse. As stated by the World Health Organization, instances of such violence encompasses practice like female genital mutilations, honor killings, murder, forced and early marriages, and sex trafficking. It is estimated that nearly 1 in 3 women globally has encountered one or more of these types of violence at some point in their lives. In Zambia, 39% of girls are weds by the age of 18. In their circumstance, families experiencing financial hardship frequently arrange marriages for their daughters in exchange for livestock or monetary compensations. This issue represents a significant challenge that Maggie Sililo, under World Renew Gender Activism Committee in Sankolonga, 70 kilometers northeast of Mwandi, has dedicated years advocating.
Nakina Maggie Sililo ni yomo muwamalida mwa gender mwa Sankolonga mo. Mwa Sankolonga ni batu baba inzi 20 venveleka ni bona. Batu ba 20 bao musebezi wa luna kiko kena ma community kwa mbolera batu za gender. Gender yeo itoloka kuli musali ni muna baswanela kuleva ni kaze za maelera.
My name is Sililo, one of the leaders for gender in Sankolonga. Here I work with 20 people. Our work is to go in the community to teach people about gender. Gender means that a man and woman should have similar things and not undermining or demeaning the other. The women are encouraged also know their rights and they are taught about their rights. We also discuss about gender-based violence, child abuse. In the community of Sankolonga, people are now able to bring reports to us. Nowadays, even the abuse cases to women and children are reducing because of these teachings. It's not only teachings that we do, but we also encourage discussions so that we can get views from the people of the community. We also use the Bible so that we do not sway away believers and to use examples of the Bible. There's a lot we are doing about gender in our community. Even in schools, when a child being abused is identified, we are called to talk to the child and guide them.
Tuto sakata kwa skolo kulimwanana hasa babaleli hande sulu kubaba utiwa wakala kuba mwanana ya sinazibo mwana kilasi kabukuswa ni Sankolonga kona misebezi oswele kweza lu batu babaveli baba munibona bakata otazeleza.
Healthcare professionals are essential in combating gender-based violence (GBV) by offering immediate support, connecting survivors with necessary resources, and contributing to violence prevention efforts. During the 16 days of activism against gender-based violence, Faith Chipuka, a nurse at Mwandi Mission Hospital, has been actively promoting unity in the fight against GBV among students at Mwandi Primary School.
My name is Faith Chipuka from Mwandi Mission Hospital. Today we are at Mwandi Primary School where we are talking to young girls and women about the theme which says unite to end violence against women and girls. So we've decided to come and talk to the girls, mentoring them on the prevention and how they are supposed to report the gender-based violence cases. So we started with defining a few terms like gender and sex because these words are usually misunderstood. So after defining those terms, we also talked about the types of gender-based violence, which includes emotional, physical, and sexual abuse. Then after classifying the types of gender-based violence, we also talked about the causes of gender-based violence. We talked about the prevention of gender-based violence because if the girls do not know how to prevent gender-based violence and what gender-based violence is, they are not going to know even when they are being abused. So the girls have been taught that they are supposed to be whistleblowers. They are not supposed to wait for something bad to happen to either themselves or their friends before they can take a step. So our interest is in ending the vice and not necessarily how we should report. But in an event where the act has already been done, they've also been taught on how to report the cases, which is mainly at the police. But in an event where they don't have the courage to go to the police due to fear and any other reasons, they can report to anyone that they're comfortable with, be it a teacher, be it an uncle, a friend, or anyone who they feel can be of help, and even to their friends. So as girls, they've also been told that if a friend reports to them, they are not supposed to judge the person or make them feel bad about the reports that they've done, because if they do that, it means their friends are not going to be comfortable to open up. So mainly, that is what we had today.
My name is Namatama Zulu. I'm from Mwandi Primary School. I'm here to tell you about what we've learned about gender-based violence. Our theme was Unite to End Violence Against Women and Girls. And I learned that a lot of girls have been abused. Have been abused in their homes, places and provinces and the whole wide world. So every minute women are dying and people are dying. So I'm here to tell you that you have to report to the nearest victim support or the police station to tell them that gender-based violence is real, so that they can help you, so that you can have a nice future. Some of the other people, they like telling you that you won't have anything in your future. So I'm here to tell you guys that you have to report to anyone who is near, especially the victim support. I'm here to tell you guys that some of the others are not here. My friends, my classmates are not here, but I'm here to tell you that gender-based violence should end from now on until the 10th December 2024. It has to end. And I want to just wrap up that gender-based violence has to end before the 10th of December 2024. And my name was Namatama Zulu. Thank you.
The celebration of World AIDS Day and Gender Activism on December 2nd, 2024 featured a vibrant array of activities including a parade, songs, dances, dramas and poetry. The event, organized by World Renew and the United Church of Zambia, emphasized the importance of unity in the fight against stigma and violence. During the public address in Mwandi, there was a strong commitment to promoting gender equality and empowerment.
As stakeholders, yes, of course, from UCZ, World Renew.
World Renew UCZ.
Okay, so I'm coming from UCZ. With a partner, World Renew.
World Renew.
Yes, so as you may be aware, so World Renew is implementing a project here in Mwandi.
World Renew is my project here in Mwandi.
Of course, with UCZ being the main implementer. Yeah, and World Renew offering technical support.
World Renew
Yeah, so today we've gathered here to address the pressing issue.
Yes,
on HIV/AIDS.
Ya kubutuku basimbande.
gender-based violence,
nikulwanisana ni likaze lwanisa basali ni bana
which is affecting
yelwanisa
our community.
wona spirit sanona
Of course, the 16 communities of Mwandi district.
wona ma libakaze 16 maskrita Mwandi.
So we must recognize
twalusona kuziba
the intertwined nature of these challenges.
lusona kuziba lika ka mozi nezi ona matata,
and of course the main impact they have on individuals.
meni butata bobufumane ahulu kumutu kamkana.
Yes, of course the individuals living in the 16 communities of Mwandi.
Twale bona batu kamkana babapira mali bakaze 16 mamwande,
especially the women and the girls.
Ka sihulu basali ni basizani.
So with that said,
ka kutali misisa kapa kunyaksisa,
it is our responsibility
ki kuluna
to advocate for a world where
kwambola kuli sibe ni zibiso,
where everyone
kuli kafera mutuka mkana
regardless of gender
kusa ziba kapa muba nakapa basali
can live without fear of violence
lwako na kupila lusasabi lindwa kapa mifilifili
or discrimination.
Kapa kulwani sana.
Of course, let us unite
kaseo au swali sane
in our commitment to combat
kaku swali sana kapa kulwani samoho
stigma,
ona butata bufumanea
discrimination
bakulwani sana
and violence,
niku lwani sana hape
and to promote gender equality.
Niku zuse za pili kulikanela kapa uzamela moho
and empowerment in our communities.
Mini kuzula pili kufumana misebezi ka spirit salona.
So together through solidarity
kafela luna
and action,
lwako na kuzula pili
we can create
lwako na kuzula pili kupanga
a safer and more equitable society.
Lwako na kuzula pili kupanga sibaka sesinde
for every resident of Mwandi district.
Kumutu kafila.
The Zambian government during the commemoration ceremony reiterated its commitment to collaborating with stakeholders to eradicate the HIV/AIDS pandemic, prioritizing women's rights, dignity, and equality.
As we stand here today, we acknowledge that the AIDS pandemic is not just a health issue. But it is a human rights issue. It is an issue of access to health care, education, and employment. It is an issue of stigma, discrimination, and inequality. We know that certain populations are disproportionately affected by the pandemic. Key populations such as the people who injected drugs, the transgender people, faces significant barriers to accessing healthcare services. Normally it is due to stigma because of their nature. We also know that women and girls are also disproportionately affected by the pandemic. As some face significant socio-economic and cultural barriers that prevent them from accessing health care. The right path requires that we address these inequalities.
It
demands that we prioritize the needs of marginalized communities. And that we work to remove the barriers that prevent them from accessing health care. Your government, the able government of the users and the President of the Republic of Zambia, Mr. Hakainde Chilema, has prioritized HIV and AIDS in the National Health Strategic Plan. By allocating sufficient resources to support the response and attainment of the HIV epidemic control by 2030. And ensure that all our health facilities have the drugs. And all that are on drugs access the drugs. So that we achieve the 95%. Yes, that is in the strategic plan. Which is translating into 95% of people living with HIV and AIDS, 95% of people living with HIV know their status. The other 95% of people who know their status are receiving treatment. And the last 95% of people with HIV treatment have a suppressed viral load by 2030. That is the 95%, 95%.
95%.
Take the right path also means communities coming together to demand access to quality health care services and to challenge the stigma and discrimination.
Vatu abapira mwasibaka nibona banani nako ngabana nitukelo yakubona kuli butukubo bwalwanisa imi bulwanisa ni butukubo bwinzi mahali kubona.
The Ministry of Health through existing structures from the district health office to the facilities remain committed in working together to create a world where everyone has access to quality health care.
Bona bo minister wa health nibona kuberetsa namoho nibaeteleli abayinzi ma lilalo kamkana babereksa namoho kuli bafumane. And
all our facilities, healthcare providers must have access to quality healthcare to ensure that our people get the services, regardless of their background, income, or geographical location. You may wish to know that the fight against HIV, case identification is key, and the district we have intensified the case findings. Offering HIV testing services at most local social gatherings. Like we have today. Evidenced by the total tests conducted by January 2024. 12,098 have been tested.
12,098 bona batu ne batatu bilwe.
And a total of 178 new positive cases have been identified.
Ona namba yo ifumani kuli batu abamu bazibire maino abona.
Currently, the total of 3,454 people in our district are accessing the protected ARVs, and more than 90% have achieved viral suppression.
Masiba kasaluna twaniso ya butuku wasimba ndembane ya namba izibali leka kutofita kachekule.
This is very good progress. Give yourselves hands.
Etwale kinzila ende wala pema zo kafelaluna.
With these achievements,
twaleka kuwina kwa
let us take the right path.
alunge nzila elukile.
Let us choose compassion over stigma.
Alukete lizwalo kulwanisa bwino bobulukataza.
Equality over inequality.
Kuswalisana kafelaluna.
And human rights over discrimination.
Nimilao ya mtu kamkana ilwanise ona kulwanisa kwa mahali kuluna.
As I conclude,
kakufeleleza
the district joins the rest of the nation to recognize the violence against women and girls.
Ona sibakasalu nansona sa basesimu sesikopana nina kamkana kwamba kabutukubo.
This is towards the launch that the president launched on the 25th of November.
Yambola kamo ka launch by the president
of the 16 days of activism.
La yakuba 16 days yakuzibisa.
Which began on the 25th up to the 10th of December.
Zivalile ka 25th November to 10th na December.
Under its theme
kakuba ma theme yeo
towards the 30 years of Beijing Declaration.
Yona kwa tuhela kapa kwa tumela kwa 30 years.
And platform for action unite to end violence against women.
Ka kuswalisa na moho kulwanisa likazelwanisa basali.
So in these 16 days,
ka 16 days yo,
you are going to see groups that are going to visit in certain places.
Lukabona tukwatanyana tukapotela libakazemu.
To talk about GBV,
kwambola ka litwanisano,
child protection,
zabanana,
and so many vices that are threatening our lives.
Nikazemu zebona isa kulwanisa pirobaluna.
This is to create awareness and show commitment towards ending gender-based violence.
Twale fo kikuzibisa kamolulwaniseza litwaniso zabasali ni bana.
So World AIDS Day falls under the 16 days.
Twale yona lizazira simbande mbande leo nilona liva hamo maliza ziliswana la 16 day.
Therefore we are all encouraged to take the right path even in the fight against gender-based violence.
Twale kulikafela aluna lwa suswezwa kuungamu hati okulwanisa onana hakapa kulwanisa likazerwanisa basali ni bana.
And together we can.
Mekafela aluna lwa kona.
We can make our district a better place.
Lwa kona kubapangasiba kasauna kubasiba kasisinde.
We can make our place a better lives for our people.
Lwakona kupangasiba kasalu na kufumana upiro obunde kwa batu balona.
Our NDMA, I thank all of you for coming.
Bakafeleza fami baitumela kafela kukuta kwa mina.
I also want to thank also the organizers.
Babada kuitumela ape kuba kwa baongaongi.
Though other difficult conditions.
Kono kwazi wala kakunyakanyaniswa matata amamu.
Because there was no light at the tunnel, but the light is being seen now. I want to thank our partners who at each time when we knock at their doors, they come to our aid to help government. Mafisa, World Renew, CMMB, DAP, YWC, I can't see.
YWC, abamiboni.
And all the other NGOs that are in Rwanda.
Nima NGO kafela, ainzi maswaka samwanti.
If I not mentioned your NGO, please forgive me.
Haiba kula baskapunda NGO yamina, please amba swalele.
But we acknowledge your presence and we acknowledge also your commitment to helping government.
Kono ulibaitumela ka kuzwela pilika kutusa muso.
May God bless the people of Mwandi.
Mulima afiole watu ba squata samwanti.
May God bless you.
Mulima afiole kafela ritumezi.
A range of services related to HIV, AIDS, human rights and efforts to combat gender-based violence were highlighted during the commemoration organized by Mwandi Mission Hospital, Cfgb, World Renew and the United Church of Zambia.
My name is Paul Swaniso. With me here is Mr. Edward. Today we are commemorating World AIDS Day, and we have come here as the VMMC department to also be part and parcel of this commemoration. So VMC simply means voluntary male medical circumcision, where we are offering circumcision services. And basically, when we talk of HIV/AIDS, we also talk about VMMC in the sense that male circumcision prevents the spread of HIV/AIDS by 60%. So basically, we have two methods of male circumcision. The first one is the conventional method, where we use these that are here. This other method where we use the ring. This is called shang ring. Bear in mind, this is the conventional method, this is the ring method. So this shang ring, we use the ring as the name tells. Even with the ring, we start by cleaning the area that we are going to work on. And also, after cleaning, then we use this. This is the tape that we use to measure. As we all know that us men, we have different sizes of penises. So we measure the penis size when it is relaxed, when it is not erect. So after measuring, that's when we are going to know the size of the ring that we are going to apply. Then after we have measured and we have discovered we have the right size, then we get this cream. This cream is called Emma cream, lidocaine. We get the cream, we apply to the penis, and then after applying, we make sure we wait for at least 30 minutes for this cream to become effective. Then after we have waited for that period, then we test for the pain, and after we are convinced to say the pain is gone, that's when we get the ring. So this is the ring. These rings have got sizes, as I have earlier mentioned. So we get the ring, we open the ring. There's one ring we're using for demonstration purpose. So this is how it is. So this one is open already. There's that one. So this one is open already. So the ring is like this. It has two parts. There's this one, the inner ring, then there's this, the outer ring. So this one is pushed inside on top of the glans penis, and this one comes on the skin, the top skin. So it has a hinge. When we place,
So my name is Faith Chupuka. I work from Mwanzi Mission ART department. So among the services that we offer, we do vital signs, which is BP, weight, height, and temperature. The reason why we do this, we are trying to rule out non-communicable diseases that have become common among our clients. Apart from that, we also offer HIV testing and counseling services. So under HIV and testing and counseling services, we have the oral quick. The oral quick, this is done by the clients themselves. We give out the kits and all the instructions and everything that they need to use is in here. So when someone tests positive, we don't record it as a positive. They are advised to come to the facility where we do the determine test. So this is a diagnostic test. So if after coming out positive on the oral quick, here it comes out negative, it will be recorded as a negative. Why? Because this one is very sensitive and sometimes it can give wrong results, especially if it is not done correctly. So we do the determine. If it is negative, then the results are recorded as negative. If it comes out as a positive, we are going to confirm using the SD bioline. So this is a confirmatory test. If this one comes out positive, then the person is positive. If it comes out negative, then the results are indeterminate and the client is advised to come back after 2 weeks. After 2 weeks, so that the test can be done again. So that is all under HIV testing and counseling. These services are offered at every entry point. That is for HIV testing, OPD, MCH, and anywhere where the client is first seen from. Then here we have the preventive services. We do distribute condoms, both female and male.
During the 16 days of activism aimed at combating gender-based violence, Matilda Njau Ngambi, a nutrition officer involved in the CFGB project in Mwandi, reported that the initiative successfully engaged 300 individuals through community dialogue and Bible studies. Additionally, 280 school-aged girls were educated on the significance of understanding gender-based violence.
We started the gender activism, 16 days of gender activism on the 25th, where we conducted community dialogue and Bible study, where 300 people were reached. 130 were men and 170 were females. And then on the 27th, we also went to do school sensitization plus a quiz. So we talked about HIV, child abuse and child marriages, where we were conducting from the schools, where the males also were involved, the girls and the boys. And then on the 28th to 29th, we were targeting the girls, 280 girls, and educating them about girl empowerment and mentorship from the schools also. And on the 2nd of December, we went to raise awareness and the various groups and the savings groups, and we talked about gender-based violence and sensitization and how they should integrate the women in their savings group and the males. And we targeted, out of the 35 groups, we managed to reach 16 groups. On the 3rd of December to 6th of December, 80 boys were engaged as we are teaching them to be agents of change in the gender-based violence, and they also talked about, they also were involved with the girls because they are the ones that are going to bring change towards gender-based violence. So the boys are the ones that were going to be agents of change. And then on the 9th of December, we distributed different pamphlets in different areas. So brochures, pamphlets, and counseling cards, both for agriculture, nutrition, livelihood, and nutrition. And then on the last day, which was the 10th of December, we were able to engage other stakeholders so that we had a march past and we were able to hold other meetings with other stakeholders.